This video will provide you with an overview of healing after wisdom tooth surgery.
You'll also be given written instructions to go home with. Directly after surgery, long-lasting numbing medicine will keep the surgical sites pain-free for several hours. Unless contraindicated, you'll be on a combination of acetaminophen and ibuprofen after surgery. These medications will be prescribed at the maximum safe dosage for you, so do not take any more than prescribed. You will take the first dose of acetaminophen and ibuprofen midday, preferably with milk or simple foods to avoid an upset stomach. Your next dose will be at bedtime. After this, continue to take a combination of acetaminophen and ibuprofen approximately every 8 hours at the following time points: in the morning, midday, and before bed. While staggering the medications may provide slightly more pain relief, doses are more frequently missed when the medications are staggered, resulting in more pain. So for simplicity and consistent pain control, we recommend taking the medications together. Make sure to take your medications with some food or milk to minimize the possibility of an upset stomach. Continue to take these medications on a scheduled basis for 4 days, day of surgery, and 3 days after, whether or not you have pain. After this, they can be taken on an as-needed basis.
For more invasive procedures, a stronger pain medication such as oxycodone or tramadol is sometimes prescribed. This medication acts as a supplement to the acetaminophen and ibuprofen you are already taking. You will take it in addition to the acetaminophen and ibuprofen, not in place of them. It can be taken at any point for uncontrolled pain, despite taking the acetaminophen and ibuprofen at correct dosage and time intervals. Like all narcotics, these medications may cause side effects like nausea, vomiting, constipation, addiction, and decreased breathing. After recovery from surgery, any leftover narcotic medicine should be disposed of at a location such as a pharmacy or police or fire department. For most patients, pain stays approximately the same for the first 4 to 5 days, and then tapers from there. You should expect the majority of the discomfort to resolve 7 to 10 days after surgery.
Some bleeding is expected after wisdom tooth surgery, but here are some steps to minimize the risk of postoperative bleeding. Starting now, right after surgery, it is important to keep pressure on the surgical sites to allow your body to form a clot and begin the healing process. In the first couple hours after surgery, it is very important to keep consistent pressure by biting on the gauze you have in your mouth. Sometimes the effects of the anesthetic medications can make you very talkative. In these cases, it will be important for your escort to remind you to minimize talking and keep pressure on those areas. Text messaging can be a useful tool to communicate needs while minimizing interruptions in gauze pressure in the mouth. When you are ready to have something to eat and drink, at home, remove the gauze in order to eat and drink. Once finished, place fresh gauze in the area and continue to put pressure on the surgical sites. As the gauze gets saturated with saliva and some blood, you can change the gauze out for fresh gauze every 30 to 60 minutes. If you run out of gauze or you are still bleeding despite the gauze pressure, a used tea bag is an excellent alternative.
When you arrive home after surgery, you likely will be hungry and thirsty. Remove the gauze prior to eating or drinking. Initially, we recommend you have a drink of water to make sure that this settles prior to eating solid foods. For a few hours after surgery, your lips and tongue will be numb from the local anesthesia, so be very careful not to bite them when eating. For this reason, we recommend starting with something soft that does not require chewing, such as pudding, yogurt, or soup. For a few weeks after surgery, there will be a small opening that could allow food to get trapped in the surgical site. Here are some foods to avoid: hot and spicy foods, and things that could get easily lodged in the surgical site, such as chips, nuts, and seeds.
You will go home with an ice pack, and for the initial 2 days, ice can help alleviate swelling. Place the ice on the cheeks and back of the jaw. Some ice packs can be too cold to place directly on the skin, so we recommend a towel or other cloth barrier between the skin and the ice pack. After 2 days, you can continue to ice if it's comfortable, but there is little benefit for swelling at that point.
It is important to keep your mouth clean to hasten healing and reduce the risk of postoperative infection. Starting the day of surgery, brush your teeth normally, but be gentle on those surgical sites. Some gum bleeding near the surgical site is normal during brushing and rinsing. If you are prescribed a mouth rinse, begin it the day after surgery and use it twice a day after brushing your teeth. Do not eat or drink anything for 30 minutes after using this mouthwash. Additionally, you may be given an irrigation syringe. If so, starting the day after surgery, flush out the lower wisdom tooth sites nightly to make sure the food debris is not lodged in the wisdom tooth sockets.
Many times, we do not schedule a follow-up appointment for wisdom tooth surgery and only see you on an as-needed basis. That being said, we are happy to see you back for any reason or concern during the healing process. Thank you, and we wish you a speedy recovery.